I'm William Shatner, and this is Heartbeat of America. Our show focuses on corporate America, its stories, its drama, its breakthroughs. We'll be going out today to report on an organization that is impacting our lives and shaping our future. An organization that truly is the heartbeat of America.
In the 20th century, William Shatner took us on a voyage into the universe to experience what life is like on other planets. Now, here in the 21st century, he's back here on our own planet to experience with us new technologies and new ways of life that are taking place on Earth. And these are for real. It's all part of a new series we call Keeping America Strong. Today, we are going to be looking at a company that is helping many people in this country who suffer from some form of heart disease to lead a much more productive and longer life. The company is Cardiomedics, based in Irvine, California, and they have developed a procedure. They've actually improved a procedure that dates back almost 50 years. The procedure is called external counter pulsation, but what they have created is known as the CardiAssist ECP, and it is quite dramatic in what it is doing and the things that doctors are able to do now. It's gaining great favor with cardiologists, and you're going to meet some on this program today. We are delighted to have with us two cardiologists who are very familiar with the system, who believe in it, and who can give us some real technical details on what makes it so unique and so effective. I'd like you to meet first on my left Dr. Larry Santora. He is a cardiologist from Orange County, California. He's associated with the Orange County Heart Association, and he is a specialist in interventional cardiology. On his left is Dr. Bijan Porat, who is a cardiologist from Beverly Hills, who is associated with the Cedars-Sinai Hospital, and he is a specialist in preventative cardiology. Two different points of view, but two very, very interesting gentlemen indeed. Let me begin with you, Doctor. If you would explain to me what it is we're talking about this counter pulsation system. What really does it do?
Well, it's a device that we'll see over here where you put cuffs on the legs and they sequentially increase pressure on the legs from the calf up to the upper thigh, then the buttocks, and they compress the blood from the legs back to the heart and pump blood back into the coronary arteries during the rest cycle of the heart. Then when the heart contracts, these bladders expand and the blood is released back into the legs. And what it does is it increases blood return to the heart, and this increased pressure in the arteries of the heart, which are called the coronary arteries, causes some type of hormone, we believe, to be released and causes new arteries to grow. So small blood vessels called collateral blood vessels grow from an artery that may be open, and they send blood flow over to an artery that's closed. And so the overall result is that there's increased blood flow to the heart. And when the blood flow is increased, the heart gets more of the blood and oxygen, so there's less angina, which is a symptom patients feel because there's inadequate blood flow to the heart muscle.
Have you been familiar with this system?
We've been doing this at the Orange County Heart Institute for over 3.5 years. We've done over 200 patients. And the interesting thing is these are the patients who are technically the most challenging. These are patients, 95% of ours have already had bypass surgery, maybe once, maybe twice, even 3 times. And so these are the patients who are not suitable for another bypass surgery. We can't open the arteries with a balloon, which is called balloon angioplasty. We can't open the artery with a stent adequately. Or if we can, with either surgery or angioplasty or stents, the risk is unacceptably high, or we think that the result would be very short-lived. So with this presentation of patients, they're very technically challenging. We put them on this machine. They go an hour a day, 35 visits, 7 days a week, 7 weeks for 5 days a week. And our experience, we've had over 80% improvement.
But my point was, were you familiar with this? And I'll ask the same thing to you, Dr. Porat. As we understand, this method of treatment was developed 40, 50 years ago, initially. Is that right?
That's correct. Well, the theoretical background for it is very understandable, in that if you have increased pressure during a certain cycle, you can increase blood flow to the heart muscle. The problem has been to develop the technology. Originally, the technology was unfortunately very cumbersome, poor, bulky, and didn't work. The present technology is highly effective, and for the first time we have studies that documents the fact that patients do get clinical benefit As a result of this, FDA has approved this as a standard form of treatment. So now a patient who has coronary disease has the option of medications, bypass surgery, angioplasty, and now external counterpulsation. From what you hear, angioplasty and bypass surgery is not a definitive treatment. When you hear somebody having 2, 3, 4, 5 operations, obviously one operation is not curative. It just delays the process of the disease. This treatment has the advantage, not only does it cure the angina so that they become free of pain, but it seems to do something remarkable to the vasculatry in that it brings back the health of the lining of the blood vessels, which are called endothelial cells. And these cells are really fundamental in the disease process. So not only does it cure the chest pain, but it seems to do some remarkable things to bring back the entire health of the blood vessel.
That's pretty amazing. Dr. Santoro, you have a picture here of the early system.
Right.
We'll get some idea of what the system looked like as it was developed, what, 50 years ago, 40 years ago?
This is probably a picture from the early 70s or late 60s. And what this is, these are metal cylinders, and within the metal cylinder there are bladders that are filled with water. And these bladders would fill with water and compress the legs and push the blood back towards the heart. But you can see the size of this is quite bulky. The bladders did not expand and deflate in a sequential manner in a reliable fashion.
And the bladders were filled with water.
Water,
right?
and they would leak. So you imagine lugging this around or having this in your office was quite cumbersome. But actually they did a number of studies on this device in the late 60s and 70s showing that it did work for angina and it did work for patients who had heart attacks. But the sheer bulk of it was difficult. And around that time, bypass surgery was quite an acceptable treatment. We started doing angioplasties, and this kind of fell in disfavor until a company like Cardiomedics came out with a more advanced device.
Now you have some other pictures here. Let's just take a quick look and see what the.
This is what those metal bladders look like. You can see they're quite bulky, and this is what a presence. This is we have 3 machines, and this is
right.
These bladders are very small now, and the consoles
These
are very
are the bladders
small.
that we see
These
on
are the
screen
bladders, and it's a very comfortable environment. The patients have headphones on. They listen to music, watch videos. And
so
this is
what happens? The bladders are they're like they wrap around the leg?
Yes, they're air-filled bladders. A bladder in the calf area, one in the upper thigh, and one around the buttocks area. But you can see it's very portable. It's very comfortable. The machine is easy to move in and out from one room to the other. It's not very bulky anymore. Very reliable.
Technically, what is happening here? The patient is laying down. She has these bladders wrapped around her at 3 different points in her body.
Yeah.
What's happening?
The patient's hooked up to an EKG, and the EKG it goes to the machine, and when the pump picks up the heart in the relaxation phase based on the EKG, the bladders will fill, and it will compress the blood back to the heart based on the EKG. Then when the heart is in the contraction cycle, the machine senses that and extracts the air from the bladders, and the bladders shrink, and so blood is returned back to the legs. The next beat, the machine senses it, inflates the bladders again in a sequential manner, and goes on and on.
So in effect, this is a pump pushing blood from the lower part of the body back up into the heart.
That's correct. There are 3 cuffs in the ankle, in the thigh, and in the buttocks.
Right.
And they are not inflated at the same time. They are inflated first sequentially,
right,
so that the blood is pushed back under pressure towards the upper part of the body. Of course, the great beneficiary of that is the heart, but also the brain gets increased blood flow, the eyes, the kidneys, and in the future, I believe that we will see a lot of developments in addition to the heart for the external counterpulsation.
Now, it's interesting. You're a doctor who specializes in preventative medicine. You're a doctor who, if I needed surgery, I would probably meet you in the operating room, right?
It's a good place to meet.
Your point is you don't want to get me to the operating room. You want to take care of me
years
before, so I don't have to go to the operating room.
That's correct.
What's this going to do to your kinds of practice? I mean, how do you utilize this? Because this is cutting down on your surgery.
Well, this is an adjunct. I think if you put the patient's best interest first, it's easy to take care of patients. Take the monetary considerations out of practicing medicine, and you do what's best for the patient. It's very easy to decide what to do. I've been an interventional cardiologist for almost 2 decades. I've been fixing arteries with balloons and stents and lasers and rotor-rooters for almost 2 decades. And I learned a long time ago that it is not always best to treat an artery with a stent or a balloon. They are life-saving, and I do many of them. And in the properly selected patient, putting a stent in is a tremendous benefit to them. It saves their lives. They can get back to normal work and a normal life and normal life expectancy. And the same thing with surgery, but it's on the properly selected patients. But there are many arteries that are so severely diseased that if you do put a stent in, it won't stay open, or they just won't get benefits from it, or the
Doesn't
risk
last forever.
It doesn't last. And same thing with surgery. So if you choose the patients properly, and I think I can choose who is better off with a stent or a balloon or surgery or this device, if you choose them properly, this really is the best thing for the patient. They get back to, the risk is almost zero.
I was just going to say, what is the big benefit to the patient when you come right down to it?
They return to a normal lifestyle. Over 80% are increased energy, decreased shortness of breath, a marked reduction or complete resolution of their angina. The quality of life improves dramatically, and many of them return to a normal lifestyle. It's hard to believe, but it absolutely works.
And in your practice, do you utilize this system a lot?
Yes, I've been using external counterpulsation for about 2.5 years. I was very familiar with its, should I say, theoretical basis. But I was not ready to buy, because these machines are expensive, until really the technology reached the point that I became convinced that now we have an effective treatment. And so about 2.5 years ago, I started applying counterpulsation in my practice. And I must say I'm really happy with it, because it's one thing to know that it works on a theoretical basis, but to see it actually in complicated patients who failed bypass surgery, angioplasty, who are taking 10, 12 medications and still cannot walk any distance because of chest pain, their quality of life is poor, to see these people return to a normal life where they are free of chest pain, it's a wonderful thing to see. And it has given us an extra modality of treatment that was never available before.
How does this affect the heart itself?
Well, it affects the heart a couple of ways. One is by increasing blood flow to the heart. When this pump pushes back, and that's the counterpulsation, it's pumping blood against the normal flow of blood back into the arteries. It increases, we believe, the pressure within the normal arteries, the arteries that are open without the blockage, causes the release of a hormone, or perhaps it's called a vascular endothelial growth factor. That is released at the end of the arteries and stimulates new blood vessels to grow from the artery that's open over to the artery that's clogged. So that area of the heart that was fed by a blocked artery is now getting new blood flow from the artery that's open. So the heart's getting more blood. One consequence that we found from this, and it's very interesting, is that a weakened heart muscle, heart that's not pumping vigorously enough because the muscle is not getting enough blood, these weakened heart muscles lead to congestive heart failure. It's a big problem in the United States. The congestive heart failure means the lungs are congested with fluid because the heart's failing to pump the blood out. Well, we've done studies with this, and the heart actually shrinks on this machine. It restores blood flow to the heart's getting more blood to the heart pumping chamber, the heart shrinks and pumps more effectively, and it's an effective treatment for congestive heart failure. And the FDA recently reviewed some of our data and from some other centers and has approved it for congestive heart failure just this past June. So not only does it increase blood flow, it increases the performance of the pump of the heart, the pumping action of the heart.
Well, gentlemen, thank you so much for taking the time to explain to us how this procedure works and why it is so beneficial. We thank you very, very much.
Thank you for having us.
Our pleasure.